Yeah, the first medication I tried was really difficult for me. I had a lot of side effects. I was too tired to work or study. I was really at home most of the time, kind of watching TV, very not me. I was so happy to get on a medication to get the clozapine that worked for me. But I remember that when I returned to the university on clozapine, I met a young man who was taking the exact same medicine I took at first, same dosage. He was pre-med, getting A's, tutoring organic chemistry, and for him, this medication that did not work for me had given him back his life. So everyone is different.
But let's go back. So what was the very first medication you took?
For me,
and why did you stop it?
For me, they tried Risperdal, so-called risperidone. I stopped it because of unbearable side effects.
Did you stop it on your own?
Oh, yeah.
Say something about that.
Stopping it on my own?
Yeah, because you've been to medical school, right?
No, I haven't been to medical school.
You've not been to medical, but you were still doing the doctorate.
Well,
right? Yeah.
I guess I was when I took it in my own hands.
That's right.
Yeah. Probably not the best idea there.
But it's something that happens a lot. And so what we often see in patients with schizophrenia, particularly early in the course of their illness, is stopping the medicines, treatment non-compliance, treatment non-adherence, missing appointments.
Yeah.
And it's a really difficult time. You know, part of the illness is that your brain's not working right. Your thoughts aren't working right.
Yes.
Insight is affected.
Mine was.
Yeah. And so when you stop taking the medicines, you're at risk for worsening of your symptoms.
Relapse.
The spells of schizophrenia tend to be episodic. Mm-hmm. The more episodes you have, often the worse your cognition can get.
Very scary, yeah.
And so these periods of going off meds and being at higher risk for relapse are really dangerous for people early in the illness.
And it was difficult for me because on that medication, for me, the side effects were really, really severe. And I wish that instead of just going on the medication, I could have been switched to a different medication, you know. Others, newer medications like Abilify, Invega, Latuda, others. So if you have schizophrenia and you try your first medication and you have very, very bad side effects, the important thing is to go talk to your doctor about it. Don't take this into your own hands. You know, you probably haven't been to medical school.
And even if you have, you still should go to your doctor.
That's right.
Right? especially if they're a psychiatrist. But I want to say something else about that. So, you know, the idea that there's one medication that's the right medication for everyone really doesn't make a lot of sense because there's no way to predict who's going to get what side effects.
Right.
And so there's a menu of antipsychotics that can be trialed. And different doctors have different opinions about what should be tried first, what should be tried second. Different psychiatrists have different opinions about when to take somebody off an oral medicine and put them on a shot medicine.
Different shots that are available.
Yeah. And so there's a very wide range of what is acceptable at the beginning of treatment.
So I remember when I was diagnosed, all I wanted to do was get out of the hospital, do my best to control my behavior, get over my schizophrenia, if that's what it was, by willpower. You know, that's what I was planning to do. But as soon as I got out of the hospital and quit taking my medication, I was right back in the hospital again. It was really difficult. I remember the doctor sat down with me and explained to me that this was a disease and it wasn't my fault. And I was ready to begin taking medication. But I switched doctors a few times before I finally found a doctor who worked best with me. I remember with him, it felt like a partnership. You know, I was partnering with this doctor to get my life back. It was a forced partnership at first, but it was still a partnership.
One of the things we get into when I train psychiatry residents are always asking me, oh, what should I do with this patient? What should I do with that patient? And they're always in this big hurry to get stuff done and to make all these changes. And I'm always saying, whoa, slow down. The most important thing is that the patient comes back to see you a second time.
Bit of friendship, professional friendship, trust.
Well, you could call it that. We call it the therapeutic alliance, where the patient and the psychiatrist are aligning together to have a good therapeutic environment
Yes.
to move the treatment forward. If the patient leaves the room thinking, I'm never coming back,
It's
it doesn't
not gonna
matter
work.
how brilliant you are at picking a medicine or
Yes.
being a diagnostician. I could be the best diagnostician in the world. If my patient doesn't come back to see me, I'm done.
Yeah.
So this therapeutic alliance is really important, and it's something that it's okay to talk about. I mean, the thing I would say to any new patient is don't be afraid to talk to the doctor, a psychiatrist especially, about how you feel about your interaction with them.
Yeah.
What's working for you, what's not working for you. Now, you had some of that happen. To the good, right?
I did.
Give me an example of that.
Well, when I finally found the right doctor, he would sit down with me, he would look into my eyes, he had very good eye contact, and I just felt that my recovery was very, very important to him, that he wanted to see me get better. It looked like he went into psychiatry because he liked helping young people rebuild their lives. I really felt that. And he felt like a friend, a coach, he felt like a mentor. I was happy to go see him because I knew he wanted me to get better.
So one of the underlying principles that you're describing is active listening. And so psychiatrists that have had training that really has stuck with them will be good active listeners. And I think that's a really important trait for somebody who's taking care of patients who have schizophrenia, because there's a tendency to not listen to people if they're psychotic.
Right.
We have a real problem with that, not just in psychiatry, but in the medical field, especially in the emergency rooms and
Sure.
when interacting with police officers and things like that. People just say, oh, that person has schizophrenia, or some worse term, which I'm not going to use,
Yeah.
and sort of write off what they're saying. But
Right.
it's important to sit down, look the patient in the eyes, and listen to them.